Okay, let's try this again. I forgot to unmute myself. Good morning. This is Lisa Hurley from York County Development District. We are grateful for you to join us on this morning's community sector briefing for York County. As a reminder, we do record these, so they are available later on if you want them. They are also being streamed out on Facebook right now, both on our Facebook page and the York Chamber page. So we will get this kicked off today with Laura McDougall from Four Corners Health Department. Laura, you're up.
All right, thank you, Lisa.
All right. You're welcome.
It's good to see all your names and faces this morning. We would like to go ahead and give that public health report. So I'll start off with the Nebraska situation, where we're hearing across the state that increasingly we're seeing more and more cases. So definitely in the last 14 days, we've seen pretty good numbers coming out of Douglas and Lancaster County, as well as some of the other more eastern counties in the state. We have, over the course of the pandemic, we're up to 45,564 total cases with 478 deaths. Now in Four Corners, I'm kind of anxious to give you report this today about, we really have been seeing increases in case numbers. We, in figuring up the case count for the last week, so that would be the week of September 24th through the 30th. I knew we were working hard, but it was that we had 91 cases last week. And in fact, yesterday was the all-time high that we've had in one day, which was 20 cases. So we are really seeing increased cases. Our all-time high week was the week prior at 61 cases. So we went from one high to the next, and from 61 to 91. So that is roughly well, you guys do the math, because it's definitely a increase of at least 50%. We have in York County in the last week, there were 25 cases. That's up from 20 cases the week prior. Seward County is leading our case count in the last week with 35 cases. Butler had 19 and Polk had 12. One of the things I like to do, and we did actually put it in our press release last Friday, we try to break it down a little bit based on a population, cases per million per day is what we're trying to use sort of as a guide to tell us, based on population, who's having the most transmission in their county. And right now, York is actually doing the best of all of our counties in our district. That's not saying much, because York is still at 259 cases per million per day. But our highest is in Butler County at 337 cases per million per day. So we'd like to see that actually below 50, or even at 25 or less. So we're way high, we're much higher than we wished we were. At this point too, York County is sitting with 2 deaths. So I want to give some updates from the Four Corners side. We have had to, because of the high case counts, we have actually had to surge now into utilizing contact tracers from the state's group. We had been getting by with our own staff and with using some contracted local people to help us get our contact tracing done. We've had to, though, as of last weekend, tap into the state's cadre of contact tracers. So if people are receiving calls from HHS, and then please just be aware that that we are using other contact tracers from the state's groups to be able to manage the cases at this point. We also have not had enough staff here to recover people. So our statistics right now in the number of people recovering from COVID have been stagnant, and we're going to try to catch up on that a little bit next week. We have extra help coming in to try to do some of that. So hopefully those numbers will start increasing next week, but at this point, we just haven't had the bandwidth to be able to do that. We're seeing also an increase of people that are in the hospitals. We've had 7, at least that I know of, in the last couple weeks that have been in the hospital. So we are still helping community members in planning their events if they're in venues that are 500 or more, that have a capacity of 500 or more. So please call us, let us know if you need help planning your events. Right now we're looking at many types of Halloween events and helping the communities plan for those safely. So please give us a call. We are right now also seeing that many of the cases that we have been somehow touched a school, whether it's the parents are sick and we are quarantining the family and the kids go to school, or it's at times it's also been some of the kids in school or teachers at school. So we have been working a lot with schools in the last couple weeks here. We have been this whole time actually working with schools. So, and I'll let them tell a little bit more about that if they wish to do that. But there has been quite a few cases involving schools. Long-term care facilities, we are seeing them ramping up the testing. So we are seeing that they are having more tests run through the staffing of the long-term care facilities. That's helping to contribute tests to that pool and bring down that positivity rate a little bit. But as all that testing is happening, we're also seeing, we have been getting some reports of positive staff. So that is, that's going on. Our risk dial we're still have that up. In the last week, it was set at 1.88, and that's in the yellow. We are resetting it today, and so stay tuned to see what that brings. We'll be announcing that tomorrow, what the setting on the risk dial will be for the next week. I would encourage everyone at this point to just stay the course. We're just seeing many more cases now. So please, everybody, this isn't, please help us to just spread the word, not to become complacent in this pandemic. We're seeing so many more cases. We would encourage people at this point and recommend that people avoid crowds. If you have to be out in the community, please wear a face covering or mask. We would also please keep washing your hands and trying to keep a distance between everyone. Even though we are in phase 4, it's going to be really important. We need to bring down the rates of transmission in our communities at this point. It's going to be really important. And we know that October is going to be a really pivotal month for us. So please help us in that effort. So that is my report. Thank you.
Hey, Laura, did you see Melanie's question? That is for you.
Yes, I do now. In York County, are you seeing more clusters of infection or more random community spread cases? We do have some cases that are associated. We're seeing a lot of random community spread, and that random community spread, then we can see other cases occurring because of direct contact from people who have been infected due to the community spread. So we're seeing a lot of spread too in households. So if one person comes down with it, we'll see other people in the family getting sick as well. So it's a question, Melanie, it's both. So thanks.
Thank you, Laura. We are I am going to turn our TV off. We're going to stop live streaming this. We're having a sound issue here. And we've already told everybody on Facebook we'll be posting the video. But give me a second because I'm going to stop sharing the screen. I know the rest of you are okay. We've already done our double check. Okay, Laura, can you say something now for me?
I can say something now.
Hold on.
Yep.
Okay, now try again.
Hi, Lisa.
Perfect. Thank you. It was hard for us to understand you, so it must be our speakers. Thank you very much, and hopefully everyone on Facebook jumps onto this. So we will go on to the medical sector. I do have Lisa's update from Henderson Healthcare. They are currently doing weekly COVID testing on their long-term care staffers. Otherwise, they're continuing to daily screen and with questions and temperature checks for all of their employees across the board. Jim, are you still on?
Yes, I am.
Okay.
I'll go through the York General Report too. Touching on the testing numbers, Laura alluded to increased testing that has been seen with the nursing homes and everything, and certainly we've seen that. But first on our drive-through testing, between the 23rd and the 29th of September, we saw 80 individuals, and that resulted in 11 positive results during just for our drive-through. And then it's not an official total yet from yesterday. I haven't heard from the crew that was out there, but I know we saw somewhere around 60 individuals through Test Nebraska yesterday. And the Wednesday before, we had seen 75. So our Test Nebraska numbers, I think, as it goes throughout the district, are some of the higher in the district. And there are usually a number of positives that come through Test Nebraska as well. So test counts just for Nebraska over the last week have been at least 140 then. And that does not include the staff testing and the resident testing now at the Hearthstone as well. So there's a lot of testing that's going through there. So Hearthstone continues to operate in accordance with those CMS regulations requiring that staff testing for us right now is once a week and using point of care testing equipment. And so we have to go through that testing now with our residents because we did have one employee of the Hearthstone that was confirmed positive, and they were not working a shift when they were confirmed positive, but yet precautions were the neighborhood in the Hearthstone that they had been working on, it was under more isolation because of that as well. And so that triggered the testing of our residents, which is now weekly. And that spun off a number of positive results through the point of care testing equipment, which we get PCR tests or more sensitive tests to verify. And that is just part of the protocol with the point of care testing equipment. It will spin off some false positives. Fortunately, all of that number of positive results through the point of care testing came back as confirmed negative. And so at this point in time, the Hearthstone has no positive testing residents. Let's hope it stays that way. So other than the testing that we're going through, we're certainly doing the same screening and temperature checking of all our staff across all our York General campuses, just as Henderson had mentioned. And we are working on solutions for our outpatient testing for cold weather. And we're completing the solution or really a drive-through garage as it is on our Westview Medical Building campus on the north end. And that should be up and running in the next week or so. And we are putting in some slight changes to our visitation policy just at the hospital. Still only one visitor that will be allowed per day per patient that's in the hospital. But that on a that can change on a daily basis. It can be a different individual that comes in and can visit a patient. That will not change. We're not going to change that, our visitation policy for newborns in the OB area, or that also won't change any of our current restrictions at the Hearthstone or Willowbrook or other campuses. And finally, we are working also on cold weather visitation solutions at the Hearthstone and Willowbrook, that we can bring those inside, but that'll include definitely social distancing and minimize the traffic that comes in the doors. For the Hearthstone, it'll be back in our great room, and it'll enter in from the back side of the Hearthstone, and then Willowbrook will be inside the front doors and immediately to your left and behind separated by a table and plexiglass and different things like this. So trying to make those precautions, as Laura mentions, so the social distancing, and also just little, as much as we can, masks and separation, but still conduct those all important visits. So that's what I have today. As Lisa knows, I have to jump off on our safety huddle that started a couple minutes ago. So I need to get going. Thanks for the time, Lisa, and everybody, and have a good day. Thanks.
Thank you, Jim, very much. I am looking to see, it looks like Mitch is on from York Public Schools.
Yeah, good morning, everybody. Don't know if I have any earth-shattering news, really. We still feel like our safety plan to return to school has been effective. We've had, as I mentioned before, we've had some cases that we've had to work through, both students and staff, and so we knew that going into it, that we would be facing that, and I feel like YPS and Four Corners has been on the same page from day one. Worked with Laura and her team first thing, let's see, yesterday morning, I think it was, or Tuesday morning, one of them, right away recognized that they're swamped, and so we pitched in and did some of our own contact tracing, just to kind of help that situation. We've sent some low risk letters out, to families, just in certain situations, and have had a great response, from parents on that, appreciative of the communication, appreciative that, our letter basically says, in this situation, we don't want to panic. We want to hear the steps that we need to take. We do have a classroom at this point in time that we've implemented temperature checks twice a day. For the time being, as I worked with Laura and her team, we thought that was a good strategy in that situation. Those families know that. They've been appreciative of that too. We've had a lot of requests, not so much here the last week and a half, but several requests prior to our uptick in numbers to consider no face coverings, and we're just not headed that direction. I don't know how long. I wish I had the date that would I suppose disappear, but YPS is committed to that. We have learned early on that the face coverings have saved many students and staff out of quarantine, and that's obviously one of our main goals, and obviously also to save them from possibly contracting the virus. Just a couple of concerns rolling in here to the next couple of months is we have some student activities that we're kind of scratching our head on. How do we do that well? How do we provide them the opportunity and still be safe? So for example, we have band and choir concerts coming up, and so we're making some moves there to, for example, our choir concert in the fall here, usually it's together, and so we're going to separate that. Middle school will have theirs first and then high school second. Again, we're just trying not to bring those big groups together. We are also worried about, like everybody else, the cold and flu season, and how we're going to make our way through that here the next couple of months. So, but I will tell you, proud of our staff and proud of our kids, because at least for YPS, we're obviously taking this very seriously and doing everything we can to stay in school. If you ever have any questions, please reach out to me. Thank you.
Thank you, Mitch. Is there anyone else from the education sector on that would like to provide an update? Okay, then we will go on to the local governmental sector. I don't see Randy on. And I know Henderson has said they have no update to provide. So Barry, do you want to kick us off?
I can briefly kick you off. Good morning, everyone. And I guess I would just echo Laura's comments that this is still out there. It's very real. And I think every one of us would say that we know more people that have either been quarantined or testing positive now than we did months ago. So, I mean, this is right kind of in front of us. So from a city standpoint, we haven't changed anything. We're just trying to keep everybody aware, wash your hands, you know, social distancing, do all the things that we need to do. And I think all of those things have helped, but we'll continue to watch this. And if it deems that we need to take stricter measures, we'll sure implement those very quickly. So for right now, we'll listen to the information and to Four Corners Health Department, and the city will work with them and follow that lead. So stay safe, everyone, and continue to be diligent about this.
Thank you, Barry. Are there any other communities that would like to provide a report? Okay, then we will move on to the faith community and the nonprofits. I know the York County Health Coalition wants to provide an update this morning. So Jake, are you there?
Hello, hi. I apologize for blurting that out in the chat room. This is Jake Owens, Executive Director with the York County Health Coalition. I wanted to take just a moment to make everybody aware that we do still have funds available to provide relief to anybody who is suffering financially. We are getting some applications. They're trickling in here and there. We just want to make sure that all of our partners, everybody on the call is aware. If you know anyone that could benefit, we have these funds and we are looking to utilize them to benefit the community. So please send them our way. Our website is yorkcountyhealthcoalition.com. Our Facebook, they can call, whatever works best for them.
Thank you, Jake. Do we have any other nonprofits or faith-based that would like to provide an update? And thank you, Emily, for the chat that you didn't have an update. I forgot to announce it when we were on earlier on the education. Let's move on to the business sector. I only have a couple of things. The next Thursday, in conjunction with the Sip and Stroll, YCDC is holding adult involvement fair. We're pulling together our civic groups and our nonprofits that are looking for volunteers. They'll be by the auditorium. So if you're looking, whether it's just to join a group or you're looking to volunteer once a year or once a week, there will be several organizations down there. Please feel free to stop in. Other than that, the end of October, we will be having our housing studies. Keep an eye on Facebook and our emails for those meetings coming up. I don't really have anything else other than what I say every week: continue to be kind. We don't know what's going on behind somebody's facade, and we got to be gracious. I'll go call Madonna.
Good morning, everyone. I also want to echo what Lisa said, being kind and being gracious. No one knows what goes on behind those doors and the great strides that everyone is doing to make sure that their business is operating safely for their employees as well as their patrons. I do want to remind everyone that Sip and Stroll is next week. Our team has been working very hard to make sure that this is a fun, safe event for adults 21 and over. We have implemented a few changes this year to ensure comfort for both patrons and businesses. We have put together 8 stroll orders that when you check in, we will give you an order and ask for you to work through that order. So their starting points are different on 8 different starting points. So there's no one business being overwhelmed. We will do a lot of our check-in outside, bring people in small groups to give them their stroll orders. And then we'll have sandwich boards, noting with the participating locations, and on the sandwich boards will be tied hand sanitizer. All of the participants will receive hand sanitizer as well in their individual gift bags. So it's going to be a great evening, and you can still get your tickets at our website or at our office. Also, I want to highlight a few things. We have Let's Connect coming up in the latter part of October. This is a great opportunity for our members to come and visit with us and tell us a lot of things that are going on, so we can help share that word and help us in that conversation of how we can enhance our benefits to all of our members and their team members. And then finally, Young Nebraskans Week is at the end of October, and the York Young Professionals have put together a great week in combination of virtual and in person. They have lined up a phenomenal speaker, Aaron Davis. He will be here on Friday the 23rd at York Country Club. And if you've not heard Aaron speak before, you don't want to miss this. So contact our office to get your reservation in for that, and check out our website, yorkchamber.org, for all the details.
Thank you very much, everyone. I hope you have a great weekend moving into tomorrow, Friday. And we will talk to you in 2 weeks. I did not see any other questions come in. Let me just double check real quick. We are good. So have a great weekend, and we will talk to you in 2 weeks. Thanks.
Thank you.